kind of got lucky just in the fact that my doctor, my regular doctor, I connected Kevin because I knew nothing of HIFU, I'd never heard of it, and he just threw it out there as an option, so I started investigating it. And the biggest reasons for me doing it is I'm only 56, and I live a real active lifestyle and do a physical job, and I'm young, still want to have sex, and don't want to have any of the problems with incontinence or anything like that, because I like to travel and you know, worried about all those sort of things. And in investigating, I found out HIFU left me the best option of not having any of those things. And like Kevin said, I was worried about going out of the country, but when I investigated it, they won't cut you. There's really very low chance that you're going to have a blood transfusion or anything like that. So, and the other side of it too was the fact that you could have it done over again if your cancer should return, which looked attractive to it. Money out of pocket did not, but after thinking about it for a little while, you know, that's the kind of money that I put into my 401k each year for retirement. And if there's nothing to look forward to, I may as well spend it. So those were my deciding factors really to go. And the flight down there was nice. We did it in the Bahamas. And just like he said, everybody in the group was from the U.S. Not only Kevin, but another surgeon there with him. And had a clinical doctor who was from, or a clinical nurse. He was from, I guess, South Carolina? No, North Carolina.
The International HIFU is based out of Charlotte, North Carolina, so most of the staff and the clinical nurses are from Charlotte.
Yeah, I actually didn't stay at the Atlantis. I stayed at the Hilton, so they picked me up in a van, 10-passenger van, the morning of the surgery with both doctors in there, the clinical nurse, 3 technicians that just take care of the equipment. I mean, they were all, you know, they do it all the time. It was made me feel real comfortable, and like he said, I was in and out in the morning and back in my hotel room. Now, the tube thing was very scary to me because I kept thinking that I could actually like snag this thing on something, and it leaked around the site where it went in for a while. It was leaking a little bit of urine, and they talk about something called bladder spasm. I didn't know what that was. But I found out pretty quickly that what that is you think you have to pee, and there's absolutely no chance you're going to do that through your penis. But you will stand in front of the toilet quite a while before you figure this out. And so basically, the time down there was spent learning how to manage the bags and the tube and switch them. I was really worried about it. Now that I've been through it all, it really isn't that scary. And once he took the tube out, I realized there's probably no chance that accidentally yanking this thing out, because I didn't realize there's a balloon that swells inside your bladder. It's not coming out. I thought it was a little stitch holding it there. And I guess when you hear cancer, you kind of go deaf. And he could have explained all this to me. The only thing I knew is I had cancer, and I had to do something. So I took my wife along with me, and she pretty much heard everything, so that helped. But you know, outside of that, I would say I would do it again. They give you 2 bags, one that hooks on your leg, so it hides under your clothes, so you can go on about doing normal things. Now, I didn't go right back to work because I work on cars, and it would have been a little too physical for me, so I was actually out of work and then I got an infection too, so I was out of work probably 3 to 4 weeks, I guess it was. And then I went back, and it was absolutely normal when I went back, and I don't have any incontinence or any of the side effects. A little bit of rectal dysfunction to begin with, but it's constantly getting better. And I don't use any kind of pumps or anything like that. I've been using just the Cialis, but I only use like half a pill for maintenance. And I think part of it's psychological, because if you try one time and it doesn't work, you get a little depressed, you're afraid it doesn't work. I'm overcoming that, it's getting better and better all the time. So I would say it's a real good treatment, and for me it's been great, and I would do it again. So I don't know if that helps anybody, but that's where I'm at with it. So.
I'd like to point out, he was nice enough to come. I appreciate you coming and sharing your experience. First thing I said is be honest. I want you to share the good and the bad experience. This is not, my goal isn't to sort of trick anybody into this. This is not for everybody, but I wanted you to share your experiences, good and bad. So thank you for coming. If anybody has any questions
for you, I can answer.
When did you have it? Yes.
I had it done on May 21st, and I just had my second PSA test, and it's 0. I don't have any recognized PSA.
How long you had the bag?
I had the bag on for 4 weeks, and I'll tell you what, they give you a night bag. If I were to make a suggestion, it would be do it during March Madness if you're a basketball fan, because you may never have to get up. That thing I came rather attached to. I hated to see it go. But,